The principal finding is it was safe and well tolerated in all these studies. If you look at this particular figure at the bottom, you'll see that in the placebo group, the number of adverse events was actually greater than the number of patients experiencing adverse events in any of the control groups. Now, frankly, that doesn't mean that the drug makes you feel better than simply taking a placebo. These are not statistically significant findings, but it's encouraging that compared to a sugar pill, our drug does not increase the rate of dizziness, headaches, and other side effects that we were particularly interested in seeing. It's very important in developing a drug to determine how the concentrations in the bloodstream change over time. It's important for dose selection. It's important for designing future clinical trials, and it's highly advantageous when a drug changes over time proportionally regardless of the dose administered. It's called linear pharmacokinetics. And KNS 760704 displays very nice, clean, linear pharmacokinetics, which is advantageous in carrying the drug forward in other trials. We also administered multiple doses of the drug and got very similar findings: safe, well tolerated, linear pharmacokinetics. Now, having completed those phase 1 studies, we're now in the throes of our first, or of an initial phase 2 study, a phase 2A safety and tolerability study in ALS patients. We know that the drug is safe and well tolerated in healthy people, but is there a feature of the disease itself that may introduce an adverse event profile associated with our drug? Our CEO, Mike Bozic, whom I mentioned, who spent many years in drug development in Bristol Myers Squibb, said the same principle that applies to practicing medicine also applies to developing drugs. The first principle is do no harm. So we want to make sure that, unlike some other drugs that have been tested recently, alas, that our drug doesn't make ALS patients worse than placebo. This is the design of our study. Jim is the individual running this study. What you see here next to baseline is that there are 4 cohorts, one receiving placebo, a low, mid, and high dose. We will observe those patients for 12 weeks for safety and tolerability, then re-randomize them so that all patients have the opportunity to receive drug, including those that had been in a placebo group. Now, it's clear that while we don't know what that rock is that drops into the pond, we do know some of its features, and we are beginning to understand the mechanism by which it causes these ripples and by which the ripples amplify each other. And that's the basis that we and others are using to try to develop new therapeutic approaches. That little mitochondrion, of which there are many thousands in every cell, appears to be a very attractive target for keeping motor neurons alive in the face of stress that comes from an unknown initiatory event. And that's where we are focused. We've entered early phase 2 studies. We've demonstrated that we're safe and well tolerated in healthy subjects. And we are committed to getting an answer about this drug just as quickly as we can. The molecule is what it is. The disease and the biology associated with the disease are what they are. We can't change either of those things. But our job as finance people, as entrepreneurs, as clinical development leaders, as neuroscientists, as doctors, is to design the best experiments possible to determine if that molecule plays a significant role in this biology. Now, closing on a personal note, this beautiful woman was a friend of the family, Reeve Marriott. She lived in Boston, and she's the reason that I got interested in ALS, and the reason that when Bob Bowser from Pitt came to me and said, I have some biomarkers that may be useful in diagnosing the disease, my ears perked up. The reason I'm inspired to share the picture of Reeve is she died about 3 weeks ago after living with ALS for 13 years. Now, she may have had a rare subtype that enabled her to have that degree of duration with the disease. She did not take Reliotech. She did not receive respiratory support. She just let her disease play its course. But what she did have was a stunningly effective support network. A group of about 24 people who called themselves the Reevettes, who actually formed a nonprofit organization to raise money. We had bake sales and garage sales all over Boston to Pittsburgh, raising money for Reeve. And she kept going for 13 years. Thank you very much. Glad to take some questions.